The Battle for Veterans Healthcare and Wounds of War. And we also have, as a special guest, Jasper Craven, VHPI Interim Executive Director. He also is running an incredible agency and is here to talk about this very, very important topic. Hi, Suzanne and Jasper.
I was in.
Okay, Jasper.
Oh, I'm sorry, we couldn't hear you there for a second.
Oh, yes.
Great to be here. So we at VHPI will soon be releasing a new report that Suzanne Gordon on this call has co-authored, along with a number of really preeminent experts in the field of veteran mental health care. And we invite your readers to view this once it's out. It'll be on veteranspolicy.org in about a week or so. We also have a Zoom forum coming up on February 3rd. But essentially what the paper tries to lay out is a lot of the pioneering work that the VA has done over the years in providing integrated health care to veterans that really prioritizes and values mental health care. Unfortunately, there's been a lot of legislative action under Trump to privatize veterans health care. And just a few months ago, there was a law he signed that for the first time really took the specific step of outsourcing veterans mental health care, which is quite alarming for a number of reasons, but, most fundamentally because many private sector practices just have very little competency in dealing with veterans mental health care needs.
Oh, I can imagine that. And Suzanne, why don't you give us a little bit of an intro too about why you think this is so important? Because I know the privatization of these services could lead into exactly what Jasper is talking about, going into unfamiliar territory for people who are providers. I've already seen that firsthand, where providers don't have the same kind of understanding as a VA system would of the particular issues or circumstances surrounding a veteran's care.
Yeah, and I mean, one of the things that we're really concerned about and that we highlight in this paper is that so much, everybody is saying that they prioritize improving mental health care for veterans. The president, the soon-to-be former president, the various people on the House and Senate Veterans Affairs Committee, and yet they keep producing bill after bill that either privatizes or basically kind of cancels the bill that came before. So there's this tendency in policymaking around mental health care to pass a bill and then forget about it and forget about implementing it correctly, and then pass another bill and then pass another bill. And it really creates an incredible amount of confusion, layers of bureaucracy, layers of inefficiency, layers of lack of coordination. I mean, we have the Clay Hunt Suicide Act. We have the Mission Act. Now we have the Scott Hannon Act. I mean, we have, a Healthy Start. There's all kinds of initiatives that have been passed. And Congress spends a lot of energy, and veteran service organizations spend a lot of energy lobbying for these bills, but nobody makes sure that the bills are carefully constructed and that they're implemented, in an effective way. I mean, it's kind of like you build a house, right? And you spend a lot of money designing it and making sure it's well constructed, and then you never bother to put any furniture in it or make sure that anybody's living in it, and then you say, oh, let's build a house next door. And huge amounts of money and energy go into this process. I mean, and the other thing is that there's no attention to whether there is enough staff in the VA to adequately provide the services that are mandated, or staff in the private sector, or coordination between the staff in the VA and the private sector. So you see real disasters. I mean, in Memphis, a veteran who died by suicide because failures of coordination between the VA and the private sector, and some private sector nurse practitioner who I suspect didn't have enough experience treating veterans changed a whole bunch of things that the VA was doing, and eventually the veteran killed themselves. And I think you're going to see more of that because of the proliferation of services, of legislation, and the legislation isn't well thought out. It doesn't build on other legislation. It doesn't make sure people are trained in the private sector to take care of veterans. But they keep pumping it out, and then they, get to claim how veteran-friendly they are.
Yeah, that's really important information, because when you were talking, I was thinking about how many, the shell bills that go through, but then also the unfunded mandates where it's only a bill in name, where you don't really put any teeth into it or put the resources that are required to make sure it works and that it's actually effective. And so, Jasper, you were mentioning earlier that there was a problem with the prioritization and going into these going into private sectors, and it's actually supported by what Suzanne just said about this one particular veteran who committed suicide. So right now with the COVID-19, it's important to focus on this every day, even pre-COVID-19. But now, particularly, there is even more of an angst or another, with this whole disease and how it's affecting us, and how have you been seeing this play out as far as the need in the veteran population for services in the VA system?
Yeah, well, there clearly is a massive need. I mean, this pandemic has wrought a deep economic toll on people, which often then leads to the exacerbation of mental illness. And so we've seen a lot of desperation in the veteran community, and the VA has, struggled because, its main challenge is its main mission is to bring economic stability and health to its people. Luckily, the VA is a world leader in what's called telemedicine, which basically allows doctors to see patients virtually. And so because of that, almost as soon as the COVID-19 virus came to American shores, the VA really sort of leaned back and started relying more and more on telemedicine. So many veterans have been able to see their continuum of care uninterrupted during this unprecedented time, whereas in the private sector, many civilians have really been unable to not only continue with regularly scheduled mental health appointments, but also haven't been able to go in and see their doctors for routine checkups or to, get assessments on other physical problems. So the VA has really done a pretty fantastic job on the whole in this unprecedented time in continuing to take care of veterans. Certainly there's challenges that the department has. Many of those stem from the fact that the department is not fully funded, and there are many open positions for psychiatrists and psychologists that have not been filled. We at VHPI really think that moving forward, that's a massive priority because, as you said, the fallout mentally from this pandemic is going to be huge.
And I think it's also important to mention that when it comes to the way, and I think we've talked about this before, the way they're dealing with the pandemic, the VA is so much better than in the private sector, and we're seeing this now with the COVID vaccines. I mean, I got an email from a friend of mine who's a Vietnam veteran who basically just sort of got a phone call from the VA about coming in and getting vaccinated. He strolled in. It took him a half an hour. Everything was fine. I'm 75, and I'm apparently in a priority group to get the vaccination. I can't find. I have two different private sector providers that I can't basically find out any information about this for. So while my friend, the veteran, went to the VA, got his shot, and is fine. I can't even get an email back from anybody about how to go about it. And, we're seeing that. I got a call from somebody who told me that at UCLA they have they have extra vaccine. They discovered they have extra vaccine. They don't want it to go to waste. So they basically call some fancy doctor and say, hey, call your friends and your family members and come in and get the vaccine and, jump the queue. They can jump the queue while they haven't given it to any UCLA patients. And in the VA, that's just not happening. I mean, nobody can jump the queue. It's being rolled out first for frontline staff and then for veterans, and veteran patients are getting their COVID vaccine. It's just astonishing, but not astonishing, because you have a broken private sector healthcare system, and certainly you don't want people going into that broken system at any time, but certainly when it's even more broken. And we're really concerned that policymakers aren't carefully considering mental health and suicide prevention policy because they want their name on a bill, they want, their legacy burnished up, they want whatever. And so we have a whole series of recommendations and a whole analysis to try to convince people to try to do a better job as opposed to just pumping out more and more unfunded mandates, poorly constructed legislation that has no oversight, and you never find out whether it's being implemented or not.
To even, support what you're saying about the private sector, even the private sector now is calling on the National Guard and military to assist with vaccinations, right, with the general population. And one of the things that you were mentioning before yourself and Jasper, one of the things that I feel, because I go to the VA system, and I feel, a sense of being or belonging with the other veterans. And I love being around other veterans because we have a common shared experience. It's almost like a family to us. And going to another outside private sector section, I had to have a little bit of physical therapy before, but it felt like just another, person in the line, and they had no special recognition for veterans. And also, what I'm worried about is that there are many providers out there that turn down Medicare, Medicaid, and they don't accept that. So if I'm a veteran and I go to a provider and I'm relying on that system outside to take care of me, am I really being taken care of as a veteran? That guarantee that the government gave about taking care of the veterans, the widows, and orphans, right? So I feel like we need to really keep this out of the private sector.
And I think veterans really need, if veterans fought for their country, they also need to continue fighting for their country and fighting for the rest of us to get the kind of care that you are lucky enough to get at the VA. I mean, when Lincoln talked about the widow and orphan and the he who has borne the battle, it was part of a second inaugural address that did not conceptualize veterans as apart from, but rather being part of the healing process that was necessary after the Civil War. And Lincoln would have been horrified to hear veterans say that they thought that their system was special and only for them, and that, they were the only people deserving of a national health system, which is essentially what the VA is. And I think that, if we need to fight for a healthcare system that delivers the same kind of quality of care to the rest of us as veterans get. I mean, sadly, not enough veterans who've experienced the joys of the private sector understand the uniqueness of the VA and what they get there. But all of us should be able to, to get that same quality of care. I mean, we now see that, the nation's heroes, veterans are not the only heroes. The nurses, the doctors, the the janitors, the dietitians in hospitals, the
That's
grocery clerks who are risking their lives every day. I mean, we need a better system for all of us, and the VA should be a model of that, and I think veterans should be fighting for the universalization of their programs, not, living in a little gated community where it's a social welfare system for veterans only.
Yeah, that's interesting. That's very, very interesting perspective on that. Is there a website that people can go to and, a call-in number for VHPI, Veterans Healthcare Policy Institute, so they can find out more information and stay in touch? Because I know you deal with policy, it's in the name, and, these bills and finding out more about why it's important to get involved.
Yeah, absolutely. Folks can visit us at www.veteranspolicy.org. Okay. There you'll find a lot of our analyses, our investigative reporting, information on who we are, and ways to contact us. We're currently remaking our website, so it'll be pretty flashy and easy navigatable soon. But that has all the bare facts. So all your listeners should go there and check us out.
And we're having a Zoom launch of this mental health white paper on the February 3rd, I believe it is, at 11 a.m. Pacific, 1 Central and 2 Eastern time, and folks can see an announcement on our website about this Zoom release of this, what we think is a really important paper.
Okay, so it's on www.veterans